Hi, this is Charles X. White, your host on HSM channel. We're on Facebook Live with Charity Productions and the television station. Tonight, we're going to continue our series on the coronavirus. We know that a lot of things have happened somewhat to get the attention, but people are still dying daily and in record numbers. We're going to open up our session with Pastor Guilford giving us a word of prayer and covenants.
Lord, we thank you for this opportunity to gather, to share with each other and with the whole array of people in the community the value of serving one another. We thank you for all that's on the panel. We thank you for all that's on the listening, in the listening audience, and give us wisdom now and knowledge that we could share that will make a real difference, because we really know that our work and your work on earth is really our work. And let your work be done and your will be done. In Jesus' name, amen.
Amen. We have an interesting set of guests, subject matter experts, and professionals that will cover one end of the discussion to the other. I want to make sure that we recap, because a lot has happened since the coronavirus first hit, and there's a lot happening now. We're looking for a second surge. The numbers are estimated into the 200,000. And the other thing is, Black people's numbers are still coming up high. And we want to focus on that. Dr. Carlisle is with us. She's a medical doctor, and she's the president of the Association of Black Female Physicians. And she's going to lead our discussion. Each panelist will talk a little bit about what they do in their business and how the coronavirus impacts them. And as well, what is some information that we need to know that we may not know? You will be able to write a question and send it to the Facebook page for those of you who are on Facebook. This program will be rebroadcast, and it will also be on YouTube. But I want to open up with this particular statistic. This is nearly 23% of reported COVID-19 deaths in the United States are African Americans as of May 20th, even though Black people make up roughly 13% of the US population, according to the data. So, Dr. Carlisle, with that as a backdrop, and handing it over to you, give us a little information about you, and then give us a little information as though we are all new patients. We are auditioning for a new patient, new doctor. Dr. Carlisle.
Good evening. My name is Sylvia Gates Carlisle, and I'm a physician executive with a large physician medical group in an underserved community 70 miles east of Los Angeles. So when we talk about COVID, it is a new virus. It was recognized December 31st. So there's a lot we don't know. As a physician, what has enraged me is that although there's much we don't know, to me, it's unforgivable that the most expensive healthcare system on the planet failed to act and recognize COVID once many people were dying in other countries. To me, that is completely inexplicable and unforgivable. The fact that Wuhan didn't know what to do is different from how we failed once coronavirus hit the United States. I think the other thing that I find enraging about coronavirus in a first world country is the fact that we still have a shortage of testing supplies. Why do we have a shortage of testing supplies still this far into the crisis? Why am I still having my surgeons decide which 5 patients they can test this week to get surgery? To me, that is completely ununderstandable and unacceptable. And then when we talk about the impact on communities of color, it's enraging that there was no plan to address the same communities that were harmed by the last 2 pandemics.
Well,
Communities of
Doc, which 2
H1
pandemics?
H1N1 and the last measles epidemic.
Okay.
So if people of color, particularly Black people, were harmed in the last 2 epidemics, who do you think is going to be harmed in the next one?
Absolutely.
And so I think if you talk about the fact that we failed to learn from previous epidemics, we failed to learn in an evolving universe of knowledge, these are things that we can't have happen again. And so we have to hold our health system and our legislators responsible for doing better the next time.
Okay. So next is Professor Keshia Beverly. Did I say it right? Yeah, help me out, Doc.
It's Byerly, sir. There's
Okay,
no
well,
B in Byerly.
Okay, you say
I'm
it.
teasing. There's no B in Byerly. No, I'm teasing.
Okay.
So my name is Keshia Byerly, and I own a company called Corporate Energy Solutions, and that's COREPORATE, because I deal with the core being of the person. And what Corporate Energy Solutions is, it's a corporate wellness and mental health solutions firm. So I basically guide executives and CEOs and just individuals throughout, their lives and their days to help them balance work and if they have mental health issues, and how to help executives and management recognize if someone has, a mental health challenge, and how to express empathy and be concerned about that situation in order to provide the proper resources in order to get them what they need at any particular time. The other side of Corporate Energy Solutions, which is me, I am basically an energy therapist, and I focus on the energy of a person. And so when it came around to this coronavirus and all these things that are going on, the atmosphere and the environment, it created an energy of fear, and there was a tone behind it. And so when all of my clients that were somewhere in the African American community, others are in the Caucasian, but mostly the African American community, they begin to fear death. And so a lot of times I say, what you fear comes upon you, but there's a way that we can handle this situation by visualizing and restating what's really going on. Now, the importance of it is definitely important, but at the same time, how you process what's going on makes a difference. So I started, saying, hey, you need to just step away from CNN or whatever channels that you watch. You need to come outside, just where you can see nature and life, and, just step away from it. And then eating right. They have to eat right in order to maintain their stress levels and all those types of things. In addition to being that African American community or African Americans in general are at more risk of it, eating is important. So if we're quarantining and if we're at home, we need to start eating right. We can't be frying pork chops and all that kind of stuff while we're quarantining, because the access to medical care is already limited due to coronavirus. So to actually enhance the risk of getting coronavirus while you're going to get other things is something that I try to help them balance and manage mentally. So I kind of focus on the brain and what they're thinking and how to restructure the way things are going. And I also coach them through a process. So even though we have a pandemic going on outside around us, we can see how can we take an opportunity to build from that? Like, what are your goals? What do you expect to, what are the things that you desire that you haven't been able to do because you're so busy running? So now that you're in quarantine, let's kind of work on these things. Let's kind of get those things rolling. And that's kind of, in a nutshell, kind of what I do and how I help my clients and individuals deal with coronavirus and everything that's going on in the moment.
All right, next, let's hear from Professor Dr. Green.
No, I'm just a LPC. I'm not a doctor.
Well, that's
yeah.
okay for the purposes of this conversation.
My name is David Green. I'm a licensed professional therapist, counselor supervisor, and just kind of want to piggyback off of just a statement there. I mean,
It froze.
Okay,
Mr. Green.
Charles, you keep rolling, Charles. He's frozen.
Okay, all right. Professor Dr. Cooper, I hope I have that right on the promotion side and your side. Let's talk a little bit about how your profession at A&M ties into all of this.
So my name is John Cooper. I'm Assistant Vice President for Public Partnership and Outreach at Texas A&M and a fellow in the Hazard Reduction and Recovery Center. And after listening to the introductions, it seems like I'm a bit of an oddball. I have a PhD, but I'm not trained in any kind of medical or I'm not a licensed clinician or anything like that. But I'd remind people. So first, my background's in planning. I work with communities to plan for disasters, plan for resilience. And I've been doing this about 25 years or so now. I'd want to kind of remind people that we're coming up on the 15th year of, 15th anniversary of Hurricane Katrina. And that storm was important because it was the first time that the nation's attention was drawn to the disproportionate impacts of disasters on people of color. And I think we're seeing that with the coronavirus. The same people are suffering disproportionately due to COVID-19. We're talking about, people of color, poor, the elderly in particular. And so, as you are in quarantine, I think Dr. Byerly was saying that these are moments that you can take to begin thinking about, all right, what am I going to do, especially in this time? We are 2 weeks into the Atlantic, and Gulf Coast hurricane season. We've already had a couple of named storms. This is predicted to be a very active season. And, given that we are already disproportionately impacted, imagine, kind of what you're going to do in the midst of COVID-19, something that's going to exacerbate the circumstances. So, I encourage folks to think about in this time when they have some downtime, what are you going to do? Who are you going to call? Where are you going to go for help?
With that part, Dr. Carlisle, you mentioned something about the two previous viruses that we should have been prepared. You are absolutely right. However, I don't know what it is about different municipalities and county governments, but throughout Texas, where I have been, the vulnerable populated zip codes, neighborhoods, and all of that, they do not get the preparation training from those municipalities. We've been doing those trainings for 19 years with the different civic clubs in the 27 zip codes that's labeled vulnerable in Harris County. There's a chart. It's called Target Capabilities List. In that target capabilities, anytime there's a pandemic or disaster, hurricane, there's what you call an after action report. And that after action report is supposed to include some corrective actions on whatever deficiencies that you need to take care of. So, so why the pandemic wasn't done is also the same question for hurricane season, mosquito season, heat season, and flooding season. It's the same process. They just don't deliver it down to us from that standpoint. I just wanted to mention that. And Dr. Cooper, uh, also, to show you how a connection, I don't know the senator's name, but a senator came up with a formula, and FEMA had to verify it. And the formula, when he did it, I think about 10 years ago, said that every dollar spent is $4 saved. When you do the mitigation, that's the dollar. So you're mitigating the threats, the risk, you're organizing logistics for when it does happen, it happens. Now it's up to every $1 spent is $6 saved. And John, Dr. Cooper, he is a special kind of guy for something that he, to my knowledge, is still the only person that FEMA funded $2.5 million to do a study on the East Coast that dealt specifically with vulnerable populations. And they haven't done anything since. But Dr. Green, Professor Green, Mr. Green, are you back?
I'm back. Okay. I'm on my phone all day, and the juice went out on me. I shat, so I had to plug it back in. So yeah.
Well, okay. Well, we all right. Come on. It's your turn.
Basically, my patients pretty much the same thing. I'm hearing a lot of stress. I'm hearing a lot of people having a lot of stress today about corona virus, and just it's starting to take its toll. It's starting to take its toll. A lot of people are confined in the house. I'm noticing that a lot of couples who hadn't been together for so long a time are starting to have a lot of friction. Thank God that the summer is here and the kids are out of school. Because a lot of I'm hearing. First, I thought it would be a lot of the African American males that would be stressed out by having all those children in the house more than likely. But it's the moms too. They having to do double duty. They're doing their work at home while the children run up and down, and it's stressing them out. So they are looking forward to this pandemic to start decreasing. And now I'm hearing at least two people asking about, they say in September it's supposed to be ramped up again. I heard your comment earlier about it's supposed to be another round of this pandemic, the numbers, and people, and a lot of African American people are saying, we might, and what I try to suggest that people find something to do inside, just like Keshia say, exercise and try to eat well. I noticed that a few other people are starting to gain. I don't just go out as much as they were, but to go to the backyard, to walk around the backyard, to throw a baseball with your relative, to get some fresh air. A lot of people on medications and they don't want to go out there with meds, but exercise, eating well, finding things to do, planning for the future, just trying to stay positive.
Well, let me ask you this question for the clinicians. Have you all seen an uptick in senior care using the digital apparatuses, or senior citizens getting in the swing of it? Do you do WebMD? Do you all communicate like that?
What I usually do in my practice is that I do practice in the community, and do a couple of nursing care facilities, and they are equipped with iPads, and so they pass. In fact, this morning we'll pass the iPad to. There'll be transportation, uh, a aid to help them, and I'll try to communicate with them like that. But I'm hearing that in because they're not on their families' end, that they've been utilizing the iPad, the Doxy Me, the Zoom, the Duo, all the apps that are out there. Uh, the seniors are starting to do it. I noticed that they would more if they have some helping them on it. They're on it. Uh, but if they, no, they're not. I guess your question was, do I see them using it themselves? Like I see these kids down the street texting us. No, they don't know that. But they are utilizing the medium, the devices with aid they are using.
Dr. Carlisle, what about in your practice?
Well, we do have some seniors that are utilizing the video chats and telehealth. I think I have to agree with the people most likely to succeed are seniors who are not socially isolated. So, a senior who has relatives who are still engaged and available can get tech support from a kid or a nephew. But I think as more and more Americans are socially isolated, we have to be concerned about the seniors who don't have anyone who can help get them on these virtual platforms.
Can you give us a little insight on the association and how you all are moving at this time?
One thing the Association of Black Women Physicians has found that the COVID quarantine has really forced us to be on a virtual platform. We are much more aggressive in virtual platforms. We used to be limited by the geography of Greater Southern California. But now, since many of us are frontline providers, we don't want to go to meetings with other frontline providers who may be potentially exposed. So we're being very active and deliberate with much more aggressive digital media just so that we can encourage each other and lift each other's spirits up. So we're having, a monthly social event on virtual platforms with book clubs and wine tastings and giving people a safe place to debrief and to talk about some of the hard things that they've endured and navigated as clinicians in this COVID time. It has been difficult for physicians to take care of patients and to watch people suffer. And so having a place where you can talk with people who understand what you're going through is helpful.
Okay, Miss Keshia, how are things in the digital world, in your world?
It's pretty much the same as Dr. Green and the doctor before just spoke. It's pretty much the same. It's more of a telehealth thing or Zoom. When I'm doing some type of coaching for the executives, I go through Adobe Connect. And so I train through that particular aspect. But other than that, it's pretty much the telehealth, Adobe Connect, Zoom, DoxyMe, Simple Practice. Those are all virtual softwares that we use to do virtual sessions with our clients.
Dr. Cooper, give us a little bit about the value of mitigating threats in the planning process in a neighborhood.
Yeah, I think you said it best when you were talking about the return on investment. That every dollar spent on mitigation and planning is worth at least $4 of relief and recovery after disasters. And based on my experience, the key to community resilience is the engagement of people on the ground in those places. The people who have the relationships, the people who know how to, who know where help is most needed, right? And this is an issue that is not given enough attention, I think, in planning. You talked about how, as far as you know, I'm the only person who has been received any resources to do mitigation planning with communities. And sadly, these days I have to remind FEMA that they paid for that and that it still is out there. They don't utilize it enough. But yeah, the key to community resilience is community level planning, community level readiness. And I think, as you said, the return on investment far outweighs the money that you spend on relief and recovery after a disaster.
What about the mechanics of the Institute and how you actually, work with the environmental component, traffic, walkability. Talk about the institution and the community.
So what I think you're asking is how do we engage? And,
Yeah, the
yeah,
mechanics.
what is our process? And I can tell you, every place that I work, we work by invitation, right? We reach out and we ask potential community partners, kind of what is their history, what benefit do they see in partnering up with us, and if there's a mutual interest, we begin by working to establish a local task force, one that's representative of the community that we're working. All right, we begin to gather information from formal sources about the level of risk and vulnerability facing those places. But we also seek the what I call indigenous knowledge from the folks who live in the community, because they know their communities best, right? They've been there for generations a lot of times. And we take the information from formal sources, and we combine it with the information that we get from community folks. And then we use that to have a conversation about what's worth doing in this place, what the level of risk is, and what's worth doing in light of.
All right. Now, Mr. Green,
Yes, sir.
you have a patient that's stressed out and just went through the 14-day quarantine. They just went through the 14-day quarantine. That person is about 50 years old and coming to you for motivation, direction, all the services that you offer. How have you had to connect with some direct services in a referral network for like the city and testing and tracing? How do you get involved with what you do plus?
Well, I've been hearing out there, of course, the information is that you can reinfect yourself, if you have the COVID. So they're after going through a 30-day or a 2-week, 14-day quarantine, a lot of people are a little bit shaky. Those are the ones who come in with the shield on their face, or there's the ones who have the gloves on when they walk in through the door. And what I do is I tell them just to, as far as resources are concerned, most of the time they have already been, they have, I guess, permission from their jobs to be off or whatnot. They're taking time off. And what it is they want to get closer to their families who they miss. They want to go shopping. They want to get out into the community, but more or less they are afraid to be reinfected, be in that situation again where they have to go through quarantine. So, I tell them to utilize the systems that's available, like as far as having groceries brought to your house. If you want food out, use the DoorDash. Find you some books. Try to read some books on your back porch. Outside, get you some fresh air. Now that you're able to move around a little bit more, you can take walks down the street. But as far as using resources, unless they have a particular need. Now, most of the time they're just stressed out. I like to do stress relief exercises and techniques to help them, but usually when they're just happy and relieved, but they're a little nervous about being close to people. Those are the people who, when you're in the grocery store and you have a mask on, and everybody has a mask on and they don't have a mask on, those are the people who are the most likely to say something or to walk away from those people because they have been under the strain of being quarantined. I mean, really quarantined. And sometimes I've noticed that there's a few people around 50 that's been there by themselves. Now their families have been calling and they'll come to the door and they say hi through the window, the kids and stuff, but they had a pretty tough time of it. They have.
So, Ms. Keshia, have you seen any of the young? Are you a millennial? Ms. Keshia, are you a millennial?
I am in between millennial and baby boomer. If that's one, I don't think that counts. Huh?
That's no category. Okay, but let me ask you: do you see? Are you seeing any young folks? Are they coming in? Are they stressed out? How anything happening with them?
A lot of my conversations with all of my clients are done through phones and telehealth. When they come, they are stressed out. I will say that. And what I allow them to do is talk through the feeling, because what I want them to do is feel the feeling and release it. And once we release it, then we recreate the goal of what we're going to do next. So mine is almost like a coaching process. I'm coaching you through life. I'm coaching you through stress. I'm coaching you through having to work from home, and then you have husbands and kids and all these people around, and then your boss is calling. I'm coaching you through how to maintain mental sanity in the process of everything that's going on. But most of them are still stuck in the house because that's where they spend most of their time, because they have to work 8 hours plus a day. That's the majority of, because I'm doing the staff trainings and all of those, and the staff coaching and the leadership training. Most of them are in the house. Now I have a couple of clients that are locked in their condos. That's something on a whole nother level, because they've been locked in there for over 40 days. And so I allow them to express the feeling, talk it out. Okay, so how can we, when they feel the feeling, what are we going to do next? What makes you feel better now? Or how are you feeling now? So let's find the purpose in this. So let's think about less stress. So I'm almost like a narrative or a little person on the shoulder trying to recreate a new way of thinking so that they, can maintain the sanity.
Do you get involved with any other service network that you may have to refer them somewhere else? Or do you have an existing list, or did you have to create a list, or is that part of what you do?
My clientele, I refer them to, if they need like a psychiatrist and they need medication, then I refer them out to those type of resources. Pretty much with, I work with grief therapy, spiritual therapy, marriage and family, adolescents when it's sports performance, all those types of things. I work with the more the coaching side, but if there's a greater need for more than what I can do, yes, I do have. I have a doctor that's on my team as a psychologist, so I refer them to her. I have a couple of multicultural counselors, and I refer them out to them depending on who they prefer. I actually have school counselors on my team that if it's a student that needs more assistance, I refer them out to a school counselor that's on my team. So yeah, I do refer different areas to different counselors and coaches.
Well, let me ask this, since you said spiritual health.
Mm-hmm.
I'll go to Pastor Guilford.
Okay.
I
can't see you anymore. Did I do that?
What about the members or the people that you come in contact with when we have a double disaster? I'm talking about George Floyd.
Floyd, yes.
I'm talking about the pandemic.
Yes.
And then the unmentionable.
Yes.
It's President Trump.
Yes. All of these pandemics have a way of coming together to make people more stressful, more challenged. Then, we have food issues, we have financial issues, we have future issues, what's tomorrow going to bring. And so in pastoring in this environment, it takes a lot of trying to be available in the right now, the now moment. We don't try to push our people. We try to be there for them. Just to normalize situations. Try not to be so heavy even in your teaching and in your preaching. And maybe that's a tough word to say, but the people that deal with people understand what I'm saying. Let your preaching be inspiring, encouraging, and leveling certain sensitive issues that people are dealing with. So we know that we have people of all ages that we're dealing with. We're dealing with people that's been in their home for 30, 60 days, 90 days, and some of those people are maybe above 60, above 70, and they've never been cooped up. That's the wrong expression, but cooped up in their homes for those periods of time, and they're fearful of going out because of what they are seeing on the media every day. And so, as pastors, we have to be very sensitive, very concerned, and then, most importantly, try to put ourselves in some way in the space of the people that we serve so that we can have a lot of compassion and care during this period. And that's where we find our biggest challenges, just to really learn to love and to the extreme almost, to make sure that our people feel care and compassion and the needs are met.
Okay, Professor Cooper, I want you to come take another swing at and use the example of the Manchester Project and how you move through that community to aid the community residents that empowered them to take on that challenge, because you all provided some technical expertise.
So the Manchester community is one that we work with on some assessment of flood hazard risk, ground contamination, and infrastructure quality, infrastructure as a function of the ability of a community to handle flood waters. And so in that case, again, Charles, I think what you're talking about is that we didn't come in as a subject matter expert and try to do for the community, right?
Right.
We have to work with them.
Right.
We try to engage them in gathering data about their own community. We help them with the analysis. We involve them in the kind of the conversations, the deliberations about what strategies were most appropriate there. And then we involve them in the not just the documentation, but the write-up of those recommendations and those strategies so that they could use it for their benefit. So we work to inform their understanding of the technical issues there, and we help them decide among a range of technical strategies to deal with their issues. And then we worked alongside them to try to implement some of those.
Well, one of the reasons I keep coming back, and one of the reasons I invited you to be a part of this particular discussion, is because there's interconnectivity with all the disciplines. And you can take the process of one discipline and apply it to another situation. The key is to understand process. And a lot of times I've seen with the seniors that we work with and some of the young folk, we want logic. We like to hear logic because that way we can process it. And the more we get into the processing of whatever the information is to our benefit and greater good, we build a better society. Dr. Carlisle, let me come back to you.
Charles, I just want to, affirm what you just said and just add that in my years of doing this work at a community level, I found that lay people can understand highly technical information. If you explain it to them on the front end, if you work with them in gathering it, it makes total sense because it deals with their context, their reality, right? And they want to know more about it, and they're able to process it and make wise choices in light of it.
What about that example when you were in South of North Carolina, Augustine or something, and the people were doing the mapping? Share that with us.
You mean the data one, or
the one where the county was trying to map out the area,
And they were interested in the demographics, the population in the area.
Right.
Yeah, and so as part of our work, one of the bits of information we gather is related to the demographics of our area. So we want to know what percentage of population of Black folks, white folks, et cetera. And so I presented some information, and I was in a place where the Black population was very small, very limited. I knew that going in. And so I presented the data that I got from formal sources. It turns out that the number of Black people in that place, according to the census, was something like 0.7% or something like that of the total population. And someone raised their hand and said, no, that family moved, right? So the lesson was you gotta test the formal knowledge against what the people in the community know.
Right.
Yeah, and the other part of that story was that the county guy had the map on the table trying to show this road, that road, and the people in the community showed him roads that he didn't even know existed.
Right.
So that's that indigenous knowledge that you were speaking of.
So before we started, we had to update the formal map to reflect more of what the real situation was on the ground.
Right. So Dr. Carlisle, I hear in your conversation, I think I hear, you have a serious passion growing in and over there on helping Black folk. That's what I think I'm hearing. Because when you get wound up on the last teletown, when you was on the teletown, I thought I heard it. I thought I heard a little bit today. So what, as a doctor, as a Black person, what do you want us to know about the health during this pandemic?
The first thing is that the federal government has known what communities did not have resources and has tracked that data since 1967.
Mm.
So the fact that we don't have a plan yet means that we cannot hope our knight in shining armor is coming to save us. We have to use the strategies that have helped us as a people since before we came to this continent. And some of that is community engagement. No man is an island. I think the church and other social structures have been key to reaching out and helping us support each other. And so now, in the time of COVID and quarantine, we have to use these old strategies in new ways. And that we really have, as a community, to help each other, support each other to get through this. Yes, when we're through this, we need to hold the system accountable for doing better by us. But most pandemics last 3 years. Mm-hmm. We need a long-term individual and community strategy to get us through. And a lot of this is relying on each other, our friends, our family, our neighbors, our loved ones to get us through this. Because there's no question, even without the issues of police violence, this will be a challenging period of time. So we need the church and other social structures and community structures to get us through this.
Okay, so it's about 7:14. We're gonna sign off at 7:30. Our engineer, Mr. Morris Parsons, and our in-house television engineer, Mark Pirtle. Mark has been working in this field. I met Mark 20 years ago, and he's still doing it. So we have two IT techies on, and we thank them for helping us coordinate and facilitate. So Ms. Keshia, give us your elevator speech on what we should know and do Or what is it that we don't know right now that we need to know right now so we can do?
Okay, so I'm a solution focused person. And I feel like at some point we need to change the trajectory of how we think and see things. And some of the ways that used to work don't work anymore. So I feel like there should be an openness to receiving different information so that things could be done differently, so that results that we've been trying to receive in this particular community can be fulfilled. For example, the process of how the poverty mindset and the poverty mentality. And a lot of times, these low socioeconomic demographics are from a mindset. So if we can help shift the mindset of how people think and see things in that community, I'm not saying that everybody has a victimized mentality, but if we can just pull them up out of that mental process, then I think that when we come together in that area, then we can move forward as a cohesive, unified community to press the other issues that are going on in society.
Okay, Pastor Guilford,
Yes.
what would be your sermonette to a grandmother that's stressed out?
I was thinking of that when I almost said Pastor Carlisle. I was thinking of that when Dr. Carlisle
She was preaching now. She was preaching.
I said perhaps I should bring her in because I feel a little preaching in Dr. Carlisle. But what I would actually do for a grandmother that's feeling stressed, first thing that we think of, and we do this in our church right now, is that we attach someone to them. So the first thing we do is try to make sure that every part of the church family has some kind of attachment outside of that family that's within the church family or community family, so they can have someone to talk to. Because I think one of the things that really challenges our elderly people is when they are going through these things alone, and they are not able to communicate, or no one seems to have them on the frontal lobe of their mind. And so that's the thing that I have suggested, the thing we're working with now. We're using every method that we have. We're using conference calls, we're using Zoom, we're using personal calls, every method that we can to make sure that individuals feel needed and feel valued. Because once that happens, it has some kind of medicinal healing to it when people feel valued.
All right, Mr. Green.
I could.
Wait a minute. I want you to be in your car salesman mindset.
Yes, sir.
Car salesman. Rah rah. So you got a 40-year-old man, 4 children, working part-time instead of full-time. He comes to you. What do you need to tell him to get him to the next day?
Well, basically, what I like to tell my patients, especially when they're in a situation like that, is that it's going to get better. And when it gets better, you'll be so used to where you are now that you will be able to excel and push yourself forward, and the kids too. You get used to the kids. Being at home. I think the biggest problem with someone who's 40 years old and have youngsters at the house is the thought of taking care of those kids. You know what I'm saying? Taking care of those kids. And so I would tell him, in a situation like this where you home, if you could double down on it, if you can get the kids together in the morning, get them on a little regimen in the morning. Y'all do school work in the morning. You cook for them instead of trying to push away from the situation. If possible, you join that, you get in touch with that situation. And the money thing is maybe you could find a job working from home. Maybe you can get another part-time job answering phones or whatever, or doing something at home. Another resource would be family members. See if someone has knows about a job offering something that they can do at home. If he is at home, if he has to watch his kids, I would try to regiment them up. I would get them up in the morning. We're gonna do this. Have a time they have the little free time. After a while, kids like to be engaged. They like to be if you put them in a little program, they'll go along with it. They'll love it. You give them a little time. And you they have their little hierarchy. You just try to what I would tell someone if they were at home. Now the money situation, that's a little tricky, especially if you are trying to have kids there. I've been noticing that a lot of people are having a lot of stress, and it kind of trickles down to the children. I would see if he can get some help at times, like during the afternoon, maybe have one of his cousins come by, female or male, just to stay with the kids while he, maybe takes a drive or just gets out a little bit. It's this pandemic is it's not going to last forever, and I think that we should understand and that we've had tougher times than this. I think the doctor was correct when she said that our government is not putting the resources where they need to be as far as we're concerned. A lot of times we sit there and watch TV. I tell a lot of my patients, you watch 15 minutes of television, or before you even turn this volume up on your TV, look at the bottom of the screen. If it says Colbert, turn it until you find something that you want to watch. Watch that for about 15 minutes, and then move on. It's good. We need to be informed, but we don't need to oversaturate. I see that with a lot of the millennials, and as well as the older people. It's just really stressing them out if they watch the news. And now we have the George this racial stuff going on, George Floyd situation, and I'm noticing that a lot of my Caucasian clients, they are looking at me funny. So everybody's going through some stress right now, and I think that we can all get through it. We just have to not allow it to stress us out to the point that we do something silly. We do something, go out in the society. If someone has COVID, you stay away from them. I can't control everything that goes on, so I would just go with the authorities until I can find a better way, until we get a vaccine for this thing.
Okay, Charles kind of dropped off, and so we'll continue with the line of discussion that he had as we close out. I want to go over to Mr. Cooper, Dr. Cooper, as it relates to we're coming into the hurricane season. We got a very active season coming upon us. There's power in proper planning, and you're a bit of planning. Give us some words of encouragement or some instruction for our community that we can do to be ready for this storm, so that we're not scrambling at the last minute trying to make preparations to deal with the storm.
I don't know how many times you can say, we can never say enough that an ounce of prevention is worth a pound of cure. And I talked about in my opening how disasters in the form of hurricanes, tornadoes and other kinds disproportionately impact people of color, underserved communities. And although disasters by definition are things that you can't plan for, there are things that happen in every disaster that we can plan for. And I think, in all my experience, one of the things that breaks my heart after every disaster is the lack of attention that's paid to the kinds of things that we've discussed here today. My realm is physical and, design, physical space, recovery of physical space. But I wish and hope that there be more resources, more attention spent on, kind of mental and spiritual recovery. Right, it's well documented the toll the disasters take on familial relationships, the development of adolescents, and so we just need to spend more time on that. And I feel like there's an under theme here that as we as a community talk about kind of reimagining policing, we also need to be reimagining the way we deal with preparing for disasters of all kinds and how we handle long-term recovery. It's really more of a humanitarian endeavor than anything else. And so, again, we've been through a lot, and we know how to adapt, and come out on the back end. But that's made a lot easier with pre-planning. I know it's hard. You may not be able to stockpile resources if you don't know where your next meal is coming from. But you can have those conversations about, who am I going to call when I need help? Okay, what resources are out there for me, and the time is now, not in the midst of the crisis.
Well, I'm glad to hear you say that, because what we see and saw with George Floyd and all these young voices, old voices, stable voices coming to the same table with the same conclusions. And for me in my space, as you know, Dr. Cooper, my question is to question municipalities, since you do have the protocols and the process to mitigate risk in neighborhoods that you define as marginal, with unmet needs, underserved, injustice, disparities. You label that government, and you won't come in to mitigate the risks that you helped set up. The developers move, and in partnership with the city, created the food desert, closed the schools in the neighborhood. So there is a process. Just
Absolutely.
like the National Incident Management System was created after 9/11 and to be America's new domestic response arm, the same principles of mitigation in that arena are the almost exact same principles for a pandemic, mosquitoes, fires, floods. It's the same process. And because we are not demanding the government do its part, that they have been allocated funds to do in the vulnerable populated area, but they don't. So my re-energizing is going to be in that tone to deal with those processes of mitigating threats, and that's all threats. All right, it's 1 minute left to go, 30 seconds left to go. This is Charles X. White, Morris Parsons signing off, Mark Purtle, Dr. Carlisle, Pastor Guilford, Dr. Green, and no category for Miss Keshia.
Gen X. Gen X.
Yeah. Yes, sir. What did you call her?
Generation X, we are.
Generation
Okay,
X,
that's good.
right in the
That's
middle.
good. Yeah, we the X team.
Yep.
We'll see y'all next week. Whenever Mark tells us our next schedule is. Thank you for sharing with us. We look to see you next year, next week, and have a good day.
Yes.
Bye, everybody.
Bye-bye.
Bye-bye.